Morning, Sue. Thank you very much for joining us today to discuss all things social care. So Sue is an experienced consultant and senior children's care social manager, including disability services. Sue has experience of managed frontline services to a high standard and has been involved in supportive formal relationships with a number of local authorities and partner agencies. UK public sector organisations are coming under growing pressure to manage the increasing children's social services needs. Unprecedented demand and funding shortages have combined to put councils under pressure due to budget and demand not meeting. New analysis by the Local Government Association said these pressures have forced councils to overspend on children's social care budgets to keep children safe by more than £3 billion in the past 5 years. So Sue, from your experience, how has the public sector responded to these significant challenges around supply and demand?
Public sector is more than social care, and I think that's a really good question, because I think the supply and demand is more than social care. I think there is no doubt that in certain parts and certain areas, the lack of money, lack of resources and austerity has really taken its toll on some areas and localities. I think people as partner agencies, so if you want in that public service sense, are trying to work together in a more inclusive way, because it actually works with the children and the families. I think the pressure's been untold. I think the lack and loss of resources in that initial part of some families' intervention, such as community resources, however you want to name that, has taken its toll and created problems further down the line. I think social care agencies, and certainly with education and health, the most traditional safeguarding agencies, are looking at better intervention earlier on, because research tells us all the time, least of all the children and the families, that if we'd acted earlier in a better way, in a more timely way, so the right services at the right time, it does prevent issues for some families escalating. And I think we are trying to do that better and differently. I think with COVID, that's really made people think again about how to do things differently. And it might be a lasting legacy. And plus there's not a lot more money, but there's certainly more funding to think and to do things differently for families who perhaps may not have got into that bracket of services. Best example today would be all the computers for the vulnerable children. A massive issue about how do you go home from school and do your homework if your mum hasn't got a computer, and more to the point, you haven't got a router. So there's lots of ways of managing that differently. So I think the change is there, and I think what people are doing positively is trying to work to each other's strengths instead of almost, this is my territory and this is what we do as an agency. I think though for things like placements, I think when children do come into care, there is still a lack of placement choice. I think that really then, for an individual child or young person, does not work out the best it can. Because it should be about what's best for them, not what's available for them. And I think that continues to be, people strive to work with that, but it's still an issue. And particularly when we're on the back foot. So suddenly there would have appeared, they say, there appeared to be lots of adolescents coming into care. There'd been a build-up of that, and the figures would have shown you the amount of children on child protection plans. And again, there's nothing different. It's just us joining the dots together, really, because these same young people will be the people who probably have not been in school consistently and effectively since they were 7 and 8.
That's a really interesting point then. So I'm going to loop back to what you said somewhere in between there, around the part around that investment in the upfront and the proactive nature of it actually pays dividends in the long term, particularly in that whole part from early childhood through to adolescence. What do you think the barrier then is to moving more to a proactive way of working and more investment in the front end?
I don't know if it's a barrier. I don't know if we listen to families. I don't know if we actually say what worked for you, because we assume we think it works. So barriers are around how do you manage children and families, how do you manage safeguarding, when actually you are saying to the woman who's with the violent person or the man who's with the violent person that you question their parenting. So it's that right service at the right time. And that's a barrier for everybody. I think there are barriers because it was not seen as proper social work, whatever that means, you know, and how you manage risk in the community properly and effectively for better outcomes is those interventions at earlier times.
Yeah. So just with regards to the stats I mentioned at the start around the local government association and the funding gap in around £3 billion over the last 5 years, what impact do you think that has actually had, and how has that manifested on the front line?
It's quite fascinating this again, because again, I think it really does depend on where you work, because that impact is greater in some places than other.
And whereabouts, from your experience, sorry to cut in there, so whereabouts would you say it's probably felt the most?
I felt the most is an emotive word, isn't it? I think that were places where money is an issue in councils, regardless of social care, it will be felt the most there, if that makes sense.
Yes.
In terms of the children, it's about lack of choice for them, isn't it? We've got young people coming into care with nowhere positive for them to go into care. That isn't going to help, is it? Coming into care later on is really a big challenge for everyone, including that young person. I think it's being felt in terms of placement choice. I think it's being felt in some places, not being able, previous question, to actually put in really good early help services and early intervention because the monies have not been there, and it almost becomes a secular argument then.
Yes, yes. So I know you and I have had multiple discussions about this in the past around not just throwing resource at the problem and actually going in and doing fundamental change, and actually resources important to help with backlogs or help with a clear and present danger that somebody's in, but actually how do we move towards system change? How do we move towards that incremental change that makes a more robust system in the longer term?
I think there's lots of, so there are innovation sites that the DFE promote where people are trying to do things differently and are allowed to do things differently. So you're allowed to let off some of the regulations and some of the rules. I think systems then are maybe not systems, but certainly principles and models and different ways of doing things. I think we need to be really clear about that. We've also got partners in practice, haven't we, where you can go to where people have been regulated. I have to be careful, be regulated is good or better, and say this is what we thought was really good, and you can go to them and find out how that works. Because there's something about sharing expertise, and there's something about if it worked it won't work the same everywhere. But if your communities are similar, there are some things that you can learn and do from there. Because I think this is about getting away from this, I'll say it, bums on seats approach to something, as opposed to quality, really. So what's better when you've got a piece of improvement work to do, when you've got a project to actually implement? Do you want 5 people who really know what they're doing, or 10 because you've got more people in the room? And I think there's an element of a bum on a seat's better. I think you have to be very brave to say, actually, it's not, because this is what's going to achieve differently.
So just on that point then around the potential perception that a bum on a seat is better, the new catchphrase for today. How is it through people's understanding of how the impact is of doing it differently, or seeing other people doing it first and having some trailblazers that will then kind of naturally seep through the population of everyone doing it? And will it just take a few plucky people to do it first?
Yeah, I think so. And I think if you're a trailblazer, you should do something differently. Because honestly, not everything works the same in every place, but a bit of this and some of that might be very right for your community or for your organisation. So I think you need trailblazers. I think you need to be clear about, and people think it's a dirty word, an outcome, and it's not. If you really know what that outcome is, both for the organisation or the children and the young people and their families, together, if it's the same one, that's marvellous. You then have got your milestones, only you actually can say, yet we've achieved that. And I think we did it because this stage 1 and 2, phase 3 and 4 really worked.
So that's a really interesting point there around outcomes, milestones, visibility, and that overall end-to-end delivery, to say we did what we said we were going to do and what we set out to achieve.
Yeah, and what I'd like to see is that, and the families told us that as well, or the social workers told us that, or the care assistants told us that, whatever group of people you're working with, it's got to be what they think as well, hasn't it?
It's outcomes and impact.
Yeah,
and that's the key there. So I'm just the challenging question then is, we've mentioned there about outcomes, milestones, visibility of the end-to-end delivery. How is that balanced with value for money? Because that's the challenge, isn't it? That's the rub between the two, to make sure there's value for money, but also quality outcomes.
Yeah, I think, and certainly when you go into some places, particularly if they've been viewed as not being very good by a regulator, you come in as these people on loads of money and you don't know what you're doing. How can that be value for money? That can be a view that is shared by people. So I think you go in knowing what you're doing and are confident, and I'd like to think it's what you said before, Adam. You go in because you know you can do this well, and you go in because you actually know that this works, and it works for the people that you're working for, not particularly people regulating you. It's about what works for that community and what works for them. So there's confidence and ability that really matters, and value for money comes also because you then, that hopefully, I'm going to say the word infects properly. I think it actually infects people. I actually think they say, I'm sat here, I could do that as well, actually.
Yeah, it's the old thing, isn't it, that positivity is infectious, as is winning results.
And also just knowing that people can do that. So I've always wanted to do it that way. Nobody's allowed me to do it that way, whatever that is. Would you coach me into doing it that way? Yes, we could, yeah. And that is the value for money, because when you return to see if that's worked, the outcome's still making it. The value for money should be, when you review that, it is still the same, if not better. And
there's replicable, scalable results.
Yes. Well, that's your word for it, but yes.
So just since 2010, there's been around a 53% increase in children subject to a child protection plan, which is about 52,000 additional children subjected to a child protection plan. That's a staggering number in the last 10 years. Do you see that being an upward trajectory, or is that, do we see that kind of, has that gone through a peak, or are we still on that rise?
I actually don't know, if I'm honest. I think when there was lots of concern about young adolescents, initially lots of issues around knife crime, child protection system got used because it was the only system we had. Now we're developing different ways of managing that multi-agency risk. So I think there was an influx of older young people on a child protection plan for a period of time. I don't know how national that is. I don't know whether that'll get bigger or smaller. There's lots of people who will have a view that, is this because we haven't got the time or the money or the resources to do that early work better? Is that why we're ending up with children immediately going on a child protection plan? People would need to study in each of their areas what that increase is, and are they children who've been on a plan before? And there's lots of extent. For me, I think lack of community resources always impacts on managing lower level risk in communities. And are we surprised there's been an increase in the numbers of kids on our plan? No.
So my final question in Sufi today is just around the long-term view. So that long-term view around sustainability. I know there's been a huge amount of change over the past 10, 11 weeks that has been forced upon us. And I know our prior discussions to this one is that the rapid nature of change has been quite positive sometimes. Mm-hmm. Where do you see the future?
I don't know, if I'm honest. I said to you the other day, didn't I? There's not going to be a normal, I think, for a while. I think doing things differently and working closer with partners will be better for children and their families. I have no doubt about that. Will the effect of COVID, though, on some of those families creating itself, regardless of our different and better ways of working create even more untold issues for families to untangle, therefore creating more resources, needing more resources. I really don't know. I think there will be lots of issues with children returning to school.
I think that's a massive thing, isn't it?
And I think that in itself causes problems because that's both political and it's also, we know, there's no disputing the fact that if a child's in school, they're safer and their outcomes are better. So, and that's going to be I think that's going to be our first point of call. That, and along with children who are in school, were actually quite emotionally traumatized for whatever reason. So it's how we work together to do that. I'd like to think we've learned to do things differently and work more in partnership, and also think about what's worked previously. So there's been other incidences where people have used trauma-based approaches with kids, where there's been floods or terrible accidents. So there's stuff out there we can learn from. Certainly there's lots of stuff going on now. I just think we need to be very considered.
Yes. And like you said at the start of that question, nobody knows the answer really, do they? And I think there's going to be an awful lot of trial and error around how this is handled in the future and how we move forward from this.
Yeah, and I think so I'm sat thinking about schools, and maybe if you ask me in 6 weeks, it'll be something else that throws itself up.
I think that's the just on that end point there. This is a world that is not static. This is a world that's constantly changing. This is a world that is very difficult to predict, I think, is the key there, isn't it? And that the lack of predictability of it means that it's very difficult to plan. Yeah,
and in social care systems, you project a lot. You project, and you do lots of issues around trajectories. That's a bit difficult at the moment.
Yeah, we're all in the unprecedented unknown. Excellent. Well, thank you very much, Sue. That's been a really good chat this morning around that. And thank you very much for your time.
Thank you.